The coronavirus continuing to be a global issue. There are a lot of angles to approach this new virus, but we want to talk about the implications to sports and the sports community. Joining us right now is Dr. Sujatha Reddy, and we have seen Italy ban spectators from sporting events for the next month. Major events in the United States coming in Augusta, the Masters, Final Four here in Atlanta. How should people read this?
Yeah, and that's a hard question to answer, but I think we may have to take this by a person-to-person basis, meaning if you have a ticket to this event, I think you're going to have to wait till it gets closer. Then maybe you think about your individual health, because people may be putting themselves at risk if they attend these events. And what do I mean by that? If there's a person in the crowd sitting next to you, a row down, who has the coronavirus, you have a chance of catching it. It's just really hard to answer that, and I think everyone has going to have to make, forgive the pun, a game time decision.
Could stadiums do something about this? Can they limit the possibility of contact, or how could they possibly do that?
You know, I thought about that, and perhaps instead of having seats right next to each other, we have space in between. Wow. Maybe you limit which concession stands, you restrict people where they can go, but that really will affect the feel of the game, so I'm not sure. I even thought to myself, could people possibly be tested for a fever as they're entering, as we're seeing when people are getting off airplanes from certain countries? But we know this virus can be transmitted before someone potentially has a fever, so that may not protect you. But having said that, we know the vast majority of people that contract the coronavirus will recover with no problem and only mild, illness.
The Summer Games of 2020 in Tokyo, in Asia, it's hard to imagine how it does not impact these games. And again, I'm saying that early March.
Do you have the athletes compete without spectators?
Wow.
I don't know what that looks like, but it's a very hard decision to make. And again, as you mentioned, not something we've dealt with before.
All right, Dr. Reddy, thanks for your observations. We appreciate it.
Thank you.